To the second and concluding day of the fourth U.S. Spiritist Medical Congress. And I am Bradley Appling.
And I am Letícia Oliveira.
And on behalf of all the volunteers and the U.S. Spiritist Medical Association, we would like again to take this opportunity to welcome you to the fourth U.S. Spiritist Medical Congress, and most especially to thank you for taking time out from your very busy lives to make the effort to attend this invaluable program. As our first speaker of today, we would like to welcome back Dr. Giancarlo Luchetti. Dr. Luchetti is a general practitioner, a fellowship-trained geriatrician, and a PhD student from the Federal University of Sao Paulo. Currently, he coordinates the research department of Sao Paulo Medical Spiritist Association and the Hospital João Evangelista. He is the author of several articles regarding spirituality and health in journals, such as Journal of Rehabilitation Medicine, Medical Education, Family Medicine, Circulation, Substance Use and Misuse, and Evidence-Based Complementary and Alternative Medicine. Please welcome Dr. Giancarlo Luchetti.
Well, first, I would like to thank you all for waking up this early on Sunday. I know it's very hard. I have some problems to wake up this early. But thank you. Today I'm going to talk about the effect of Spiritist PASSI, which is a kind of laying on of hands, on growth of bacterial cultures. This is a study that was submitted for publication. We are waiting for the reviewers' comments. There are some authors that I would like to cite. That's me, Giancarlo, Renata Ferreira de Oliveira, Juliana Gonçalves, Sueli Ueda, Lícia Mimissa, and Alessandra Luchetti. That's a partnership between São Paulo Medical Spiritist Association, Santa Casa of São Paulo, Brazil, and João Evangelista Hospital. I will do a brief introduction first. The complementary medicine has grown significantly in recent decades. It's estimated that 40% of patients in the US, for instance, use some type of complementary therapy. At least 13% use spiritual healing or prayer, and at least 1% use some kind of energy therapies. So I will define for you the Biofield Modalities. According to an article from Miles 2003, Biofield Modalities are therapies intended to affect energy fields that surround and interpenetrate the human body. These therapies involve touch or placement of the hands in or through biofields. The existence of these biofields have not yet been scientifically proven. Some examples, as you have already seen on the lecture from Dr. Levin, it's Reiki, Qigong, Therapeutic Touch, Jorei, Spiritist PASSI, among others. I will talk a little bit about the Spiritism. It's the third most prominent religion in Brazil. It adopts a dualistic concept of human beings. In general, it postulates that we are essentially immortal spirits that temporarily inhabit physical bodies for several necessary incarnations in order to attain moral and intellectual improvement. It also implies a possible beneficent or maleficent influence of the spirits over incarnate humans. This is a publication for History Psychiatry from Moreira Almeida. And of course, with the Spiritism emerged the complementary Spiritist therapy. It's a range of therapeutic resources which includes prayer, fluidotherapy, charity or volunteerism, spirit education, disobsession, and passing. So now I'm going to define passing. The Spiritist passing is a kind of laying on of hands which, according to the Spiritism, results in an exchange of fluids and energies derived from the healer from the good spirits, or from the good spirits and from the healer. The Spiritist therapy, although not yet fully understood or extensively studied, has shown promising indirect results, as I have shown on the previous lecture that I gave here. In fact, several studies has involved biofield therapies and shown positive results. There is a difference between laying on of hands with intention versus the same approach without a defined intention. So we believe the intention is responsible for better outcomes. Some other studies have shown the effect of biofield therapies on human cells, such as tenocytes, osteoblasts, and bacterial cultures, for instance. So within this context, the aim of this study was to evaluate the bacterial growth in two groups of cultures subjected to biofield therapy. In this case, a group with Spiritist passy and another group with laying on of hands in 4 different situations. No intention, intention to inhibit bacterial growth, intention to promote bacterial growth, and the influence of a negative factor. And compare these two groups with the group from no laying on of hands or no treatment group. I will explain for you later the methodology of this study. So, we carried out an experimental study at the microbiology laboratory of the Santa Casa of São Paulo Medical School. The study was performed between April and June 2011. This is the picture from Santa Casa. It's a Gothic building. It's very beautiful, this building. And this is the microbiology laboratory of Santa Casa of São Paulo. Our main hypothesis for this work was that the bacterial growth in cultures submitted to different types of laying on of hands varies according to the type of the intention you gave to these bacteria and the faith of the participants. So we are trying to see if there is a connection between the intention and the faith of participants over the bacteria. So we selected 3 different groups that were employed to test this theory. The first one is the Spiritist passy group. So we selected healers affiliated to the Spiritist Federation of São Paulo State. They had to be at least 2 years of experience and aged older than 18 years old. The other group was the laying on of hands layman group. In other words, they are friends, staff, or trainees at the hospital. They were older than 18 years old of age, not belonging to the Spiritism religion. They have no prior knowledge on laying on of hands, such as Reiki, Jorei, and therapeutic touch. So they are, in other words, laymen about laying on of hands. And the other group was no treatment or no laying on of hand group. It was the analysis of the bacterial culture growth without laying on of hands, in other words, by the natural course of this growth. I will describe some of the experimental procedures. So the bacterial cultures were randomized and allocated into 3 different groups. The bacterial samples were placed in identical tubes with culture medium and presented uncovered in metal test tube racks to the volunteers. We use a netbook device with headphones to enable the participants to watch and listen to the videos. So that's a picture of some of the procedures. You can see here the notebook device with headphones and the volunteer being instructed to conduct the experiment. So the Spiritist healers were allowed to previously prepare the setting through 5 minutes of prayer and relaxation. The passe or the laying on of hands groups were carried out continuously for 10 minutes at a distance of 10 to 15 centimeters from the tubes containing the bacterial cultures. The experimental sessions were performed between 8 a.m. and 3 p.m. for 3 consecutive days. We use also some questionnaires. The participants were submitted to a well-being scale. It was a 10-centimeter long line, numbered from 0 to 10, containing questions on general well-being, peace, happiness, spiritual well-being, nervousness, and irritability. Then both groups applied the passe or the laying on of hands with lights out. It was just to increase the concentration of the volunteers for 10 minutes and under 4 different conditions. The first condition was the laying on of hands with a no defined intention. So the volunteers, the participants, watched a video about the industrial production of ethanol fuel. Yeah. And we say, pay attention to this video, and don't give any intention for this patient, for this volunteer. So we are asked to pay attention to the video with no intention requested. The other group, the second one, was intention of inhibiting. So the participants were instructed to kill the bacteria. The bacteria are bad, we want to kill this bacteria. So to prevent the growth. They watched a video with aspects of nature and relaxing sounds with no religious connotation. The third situation here is the intention of promoting growth. They were instructed to promote the growth of the cells. They watched the same video of the second condition with aspects of nature and relaxing sounds, again with no religious connotation. The fourth situation, it was the laying on of hands with a negative connotation. They watched the first 10 minutes of the film Saving Private Ryan. It was a violent combat on the D-Day, and no intention was requested. Here's a picture from a participant applying the Spiritist passe. You can see that she was concentrated into the notebook, and we asked for intention for her. I will talk about the bacterial cultures. We use here the agent E. coli ATCC. This bacteria was used in all experiments. The agent was inoculated into screw-capped tubes containing a liquid of 5 milliliters of tryptic soy broth. For each condition investigated, we decide to use 3 tubes in a bid to improve the reliability and increase the sample count. Then, the cultures were stored in an incubator of 37 degrees Celsius. The inoculums were assessed at 48 hours and again at 1 week after the experiment. We used the McFarland nephelometer scale to determine the intensity of multiplication in the culture medium. So here is a picture from our incubator there. The cultures were stored at 37 degrees Celsius. This is the use of the McFarland nephelometer scale. And after the analysis at 1 week, the cultures were seeded onto blood agar medium to test the viability of the strains. Bacterial samples not viable after 1 week were excluded from the study. So 7 tubes from the laying on of hand groups were excluded. The statistical analysis. So the data collected were input into the program SPSS 17. The demographic data for the groups were compared using the t-test, the 4 continuous variables with normality, and the chi-square test for categorical variables. We use a one-way ANOVA analysis of variance test to perform to determine group difference between PASI, laying on of hands, and no laying on of hands in the bacterial counts at 48 hours and then at 1 week after each situation. Then we use a Tuckey-Creamer post-hoc analysis to see the difference between the groups. To increase the homogeneity and to approach the normality of the data, all variables used in the analysis were transformed into z-scores before analysis. A p-value of less than 0.05 was considered significant, and we adopt a confidence interval at 95%. So I will describe some of our results. We selected 12 Spiritist healers and 12 individuals from the laying on of hands group. Due to personal problems, one of the Spiritist healers and 2 from the laying on of hand groups were unable to take part in the study, which gives us a final sample of 11 participants from the Spiritist healers and 10 participants from the laying on of hand group. 3 tubes per participant were used for each experimental condition. Each participant performed laying on of hands on 3 tubes at a time. So, in other words, 3 tubes with no intention, 3 tubes inhibiting growth, 3 tubes promoting growth, and 3 tubes with the negative influence. First, I will show here the social demographic data. The Spiritist healers have a mean age of 51.8 years old. They were predominantly females, 72.7%, and the mean experience applying the Spiritist passes were 16.2 years, so they were very experienced. The laying on of hands groups, layman group, they have a mean age of 35.1 years, which gives a difference compared to the Spiritist healers. So they were younger than the Spiritist healers. And they are also females in the majority, 80%, which gives no difference compared to the Spiritist healers. Then we assessed the general well-being of these participants by the scales from 0 to 10. The physical well-being, we noted the difference in which the Spiritist healers have greater physical well-being than the group from the laying on of hands, 8.82 versus 7.30, which gives a P of 0.006. They have more inner peace, 9.36 compared to 7.20, 0.017. They have the same happiness. They have the same spiritual well-being, but they are less. They have less irritability. You can see here 0.55 versus 3.80, which gives us a P of 0.011, and they were less worried than the laying on of hands group. Okay, then some of our results. The bacterial cultures after 48 hours, we found by the ANOVA test that the test showed difference for the inhibition of bacterial growth, which gives an effect size of 15%, but only for the inhibition of bacteria, not for the other situations. For the inhibition of bacterial growth situation, we found a significant difference between the non-laying on of hands and the PASI groups, which gives us a P of 0.002, and likewise between the laying on of hand groups and PASI groups. So we can see here at the table that For inhibition of growth, the Spiritist PASI, the counts of bacteria was 1.03 compared to 1.16 in the laying-on of hand groups, giving a P of 0.005. The Spiritist PASI compared to the non-laying-on of hand groups, it was 1.03 versus 1.16, reaching significant differences. After 1 week, these results were maintained, again, only for inhibition of growth. So ANOVA test showed difference for the inhibition of bacterial growth situation, but not for the other situations. For the decrease in the bacterial growth, statistically significant differences were found between the non-laying-on of hand groups and the PASI group, and likewise between the laying-on of hand groups and the PASI groups. This is a graph to try to make it clear for you. We can see here that decrease 48 hours, it reached a statistical difference between the PASI group and the other groups. And after 1 week, this result was maintained. In discussion, we point here that the influence of biofield therapies on the growth of different cell types has been a constant focus of research and reports in the medical literature. However, studies in bacterial cultures remain very scarce in the literature. In a recent study, Rubik and colleagues assessed the influence of rake in bacterial cultures, and they reported no overall difference was found between the rake and the control plates in the non-healing context. In the healing context, the rake-treated cultures overall exhibited significantly more bacterial than control. So they found the opposite of what we found, because we found that the Spiritist healers were able to inhibit the growth of the bacteria. They found that the Reiki practitioners in a healing context were able to promote the growth of this bacteria. Another study, another case, in fact, conducted by Morse and colleagues, reported a 54-year-old severely ill man who had hepatitis C and was treated with experimental high-dose interferon and ribavirin therapy. And he had also anemia and neutropenia. They received Reiki and Spiritist PASI as a complementary treatment. They found statistically significant relationships between these therapies. They use random number generation, so they find a quieting of the electronically created white noise of the random number generation during the healing sessions, and improvement in the patient's absolute neutrophil count. So it was one of the only studies that we found with Spiritist PASI specifically. Then, nevertheless, to date, no experimental studies have assessed the Spiritist PASI as a modality of biofield therapies. So our study was the first one to conduct this kind of study. This data raised the possibility of there being a difference between only have good or bad intentions in laying on of hands and actually making a spiritual connection, because we found difference between the spiritual healers versus the only having an intention. And this difference was more marked when Spiritist healers were requested to inhibit the bacterial growth than when asked to promote growth. We don't know exactly what happened, why this happened. This leads us to speculate that the Spiritist healers' motivation and concentration may have been greater when asked to kill bacteria, because they were harmful to humans and the cause of many diseases, than under other conditions. But we can only speculate that. Moreover, when Spiritist healers have no defined intention, the bacteria were found to exhibit similar growth to control samples. Therefore, this result lends further weight to the hypothesis that intention to inhibit growth was able to influence bacteria, even 1 week after the Spiritist PASI intervention. So these results remain significant. Of course, our study has some limitations that must be highlighted here. Firstly, this was an experimental study in which it was not possible to determine whether the influence seen in bacterial growth also would occur in vivo. Secondly, a clear difference in age and well-being between the participants from the Spiritist PASI and laying on of hand groups was observed, pointing to a possible role of other factors which may influence these results. Thirdly, a larger sample may yield other statistical differences that were not presented in the present study. In conclusion, the Spiritist PASI was able to effectively inhibit the growth of bacterial cultures compared to laying on of hands with intention and no laying on of hands. We believe that further studies comparing different intentions and different types of laying on of hands in cultures of cells and in microorganisms are warranted at this moment. I will now show a video from the São Paulo Medical Spiritist Association for you. It's our institution in São Paulo, Brazil, that are trying to promote the integration, the connection between spirituality and health for the medical community in Brazil. So, if you please could show this video.
As the video will be in Portuguese, we will give you a few moments to go to the back and obtain a translation device.
Sorry for that.
Thank you.
Então, eu deixei tudo certinho, tá? Okay, let's show the video. Thank you. Yeah, it's without sound here. Okay, we have some technical problems here. Well, just briefly, the São Paulo Medical Spiritist Association in Brazil, it's a association that promotes the interface, the connection between spirituality, health, and spiritism in the Brazilian society and Brazilian medicine. We have already published some articles. We are trying to create disciplines in the medical schools, for instance, in order to promote this dialogue. We are presenting some studies in the Brazilian Medical Congress. We talked, for instance, in the Geriatrics Congress, the Internal Medicine Congress, the Cardiology Congress, and many other congresses, the Medical Education Congress in Brazil. So we are trying to open this dialogue because we think it's very important to introduce this issue in medicine. Is the video ready? And I'm trying here to show you what is the São Paulo Medical Spiritist Association, which is it's one of the associations in Brazil. We have more than 40 associations there that deal with this issue. And the Brazilian Medical Spiritist Association, that is the biggest institution in Brazil regarding this field of spirituality and health. I'm deeply sorry about that, but I'm not very good in stand-up comedy here. Yeah. Hey, on the mic, please.
My voice isn't too good, but I have a question about the study.
Yeah, sure.
You said that 7 tubes were excluded because they weren't viable. Is that because the growth is actually inhibited that much? Because that would be actually positive evidence of more inhibition.
No, in fact, when there is no bacterial growth, probably this kind of bacteria doesn't have sufficient medium. The blood agar was not very good, so we need to exclude these bacteria. That's why we exclude, you know.
So you didn't think it had anything to do with the intention of killing the bacteria?
No, because it's in the literature is not reported as this way, you know.
Okay. Thank you.
So that's why we exclude.
Yeah, the other day you showed a slide in your previous presentation, and you made a difference between spiritism and spiritualism. What is the difference?
Spiritism is it's a religion that links the philosophy, the science, and the religion. It's from Allan Kardec, and it's Kardecist. It's different from spiritualism. Spiritualism is the belief of the transcendence, is the belief of something bigger, but does not follow any religious doctrine or anything like that. So basically that's the difference.
May I ask a question? Dr. Luchetti, that is beautiful research.
Thank you.
It's very pleasing to see it. I was struck by the difference between your research and the Rubik et al. Research, which, as you know, I was one of the co-authors of that work.
Yes, I know.
But there was an interesting difference, I think, between the two paradigms, if I remember correctly. In our research, what we did was we stressed the bacteria with heat. Mm-hmm. So these were stressed cells, reduced to 50% of their population, and then they were returning to growth. So these cells had been injured. Whereas if I remember correctly, in your paradigm, you were not heat stressing these cells. They were just growing.
Yes.
And I was wondering, is it possible that that was the reason why we actually observed a difference?
Yeah.
Because we were not looking, in this case, to heal to kill cells that might be dangerous, which E. coli can be, but we were actually trying to enable these cells to heal from having been, in fact, injured. Do you think it's possible that that might be the difference between these two studies?
Yeah, I think that's a good possibility, because I think the way the study was conducted was different, really. Because you try to heal the bacteria, no? We try to kill the bacteria.
Exactly, and the context was different.
Yeah.
And the second is, do you have any idea why the findings for the Spiritist group were stronger than if you would, these other groups? Do you have any? Would you like to speculate about those differences?
Well, I believe it was the spiritual connection. That's the only explanation that I may see for these findings. But it's a speculation, as you said.
Beautiful
Thank you,
work.
Dr. Gary.